Hello viewers! Welcome to our video today on foods and drinks to avoid if you have high blood pressure. High blood pressure rarely has noticeable symptoms, even if blood pressure readings reach dangerously high levels. You can have high blood pressure for years without any symptoms. The only way to find out if your blood pressure is high is to have your blood pressure checked. If untreated, it increases your risk of serious health problems such as heart attacks, strokes, and numerous other health problems. It affects 1 in 3 people in the United States, 1 in 4 adults in UK, and 1 billion people worldwide. Whether or not you follow a particular diet, certain foods and ingredients may raise your blood pressure or help keep it high. Limiting these foods may help manage your blood pressure levels. In this video, we're going to talk about 9 foods and drinks that you should limit to keep your blood pressure under control. As always, this video is for educational and informational purposes only, and is no substitute for professional medical advice, diagnosis, or treatment. So do speak to your doctor for a medical diagnosis if you have any health concerns. If you find the video helpful and informative, like and share it with your loved ones to protect their health. And don't forget to click the subscribe button and hit the bell to stay updated on new videos. Let's get started. 1. Salty foods. The more salt we eat, the higher our blood pressure. Salt makes the body hold on to water, and if you eat too much, extra water in the blood puts pressure on blood vessel walls. Be aware that salt also goes by the name sodium. Many people eat too much sodium without realizing it. Processed and fast foods usually contain excessive amounts of sodium, often more than the 2,300 milligrams a person should consume per day. It is advisable to check nutrition labels and be aware that even foods people tend to consider healthy, such as vegetable juice, may be high in sodium. Examples of foods with high levels of sodium: pizza, sandwiches, cold cuts and cured meats, canned soup, pickles and tacos and burritos. 2. Sugary foods and drinks. Sugary food and drinks offers few health benefits and raises a person's risk of unintentional weight gain. Also, high levels of sugar in the blood can lead to a buildup of fatty material inside blood vessels, causing them to narrow, known as atherosclerosis, and a buildup of pressure. Some studies suggest sugary foods and drinks may increase blood pressure even more than salt. They mention foods and drinks containing high fructose corn syrup as a factor that can raise blood pressure. Many sugary drinks also have caffeine in them, which can elevate blood pressure even more. Examples of foods and drinks that may contain high fructose corn syrup and caffeine include cereals, processed desserts, prepackaged meals, crackers, granola bars or other nutrition bars, sodas, flavored coffee, sweet tea, energy drinks, and fruit juices. A person should check the packaging on these foods to ensure they are choosing products free from high fructose corn syrup. 3. Red meat and processed meat. Red meat and processed meat are high in saturated fats, cholesterol, and sodium, which can raise a person's blood pressure and can also lead to other forms of cardiovascular disease. The process of metabolizing red meat in the body may also release compounds that elevate blood pressure even more. Red meat refers to beef, lamb, pork, veal, mutton, venison, and goat. Examples of processed meat include ham, sausage, hot dogs, pepperoni, beef jerky, salami, pâtés, corned beef, and sliced luncheon meats. A person should try to limit red meat and processed meat as much as possible, or choose leaner cuts. The redder the meat in color, the more likely it is to increase blood pressure levels. 4. Refined carbohydrates. Products made from white flour, like white bread, pasta, and pizza dough, are rapidly broken down into simple sugars in the blood, and in excess can lead to weight gain and increased blood pressure. Sticking to a low-carb diet has been shown to reduce systolic and diastolic pressures in your arteries, blood pressure, as well as other risk factors for heart disease. 5. Saturated and trans fats. A person looking to lower their blood pressure or reduce their risk of high blood pressure should limit their intake of saturated and trans fats. Most trans fats are formed through an industrial process that adds hydrogen to vegetable oil, causing the oil to become solid at room temperature. This partially hydrogenated oil is inexpensive and less likely to spoil, so foods made with it have a longer shelf life. However, eating them raises LDL, bad, cholesterol levels and lowers HDL, good, cholesterol levels, which can increase the risk of hypertension. Trans fats are especially harmful for your health and are linked to poor heart health, including an increased risk of heart disease, stroke, and type 2 diabetes. The more trans fats eaten, the greater the risk of heart and blood vessel disease. Saturated fats also increase the levels of LDL cholesterol in the blood and are linked to atherosclerosis. Saturated fats are mostly found in animal products, including full-fat milk and cream, butter, lard, ghee, dripping, margarine, goose fat, or suet, red meat and processed meat. Examples of foods containing trans fats include margarines, vegetable oils, cakes, cookies, microwave popcorn, donuts, pastries, ice cream, frozen pizza, and fast food. Healthy fats found in olive oil, avocados, nuts, seeds, and low-fat dairy have been found to be protective in lowering blood pressure. 6. Processed and prepackaged foods. These often contain a combination of the worst offenders: salt, sugar, or glucose-fructose syrup, and refined carbohydrates. Ready meals and fast foods often owe their flavor to lots of added sugar and salt. Packaged foods that might seem healthy, such as vegetable and meat-based meals, may get much of their flavor from high levels of sodium. Also watch out for shop-bought sandwiches, cereal bars, crackers, and biscuits. It is advisable to avoid these foods as much as possible or check nutrition labels, and choose only those products that have a relatively low sodium content. 7. Condiments. Ketchup, chili sauce, soy sauce, and salad dressings are often laden with salt and sugar. A person with high blood pressure does not need to avoid all condiments, but should look for low sugar/salt varieties or make your own. It is also important not to rely on taste, as even condiments that do not taste salty may be high in sodium. Keep salad dressing simple with a drizzle of extra virgin olive oil and balsamic vinegar. 8. Caffeine. In fact, people who drink caffeinated coffee or tea tend to have a lower risk of heart disease, including high blood pressure, than those who don't. Caffeine can temporarily elevate blood pressure, causing very high blood pressure readings. If you already have high blood pressure, consider to cut back on caffeine. People trying to limit their caffeine consumption may choose to drink less regular coffee or replace it with decaffeinated coffee. People with a history of dangerously high blood pressure may need to contact a doctor to discuss decreasing or eliminating their caffeine intake. 9. Alcohol. Regularly drinking to excess can affect the muscles and blood vessels, causing them to narrow and raise a person's blood pressure. It may also be an independent risk factor for heart disease. It contains lots of empty calories, which cause unintentional weight gain, or replace healthier meal options, which in turn will raise your blood pressure. Alcohol can also prevent blood pressure medications that you may be taking from working effectively through drug interactions. Men should stick with no more than 2 drinks a day. Women should keep it at 1. 1 drink looks like 12 ounces of beer, 4 ounces of wine, 1.5 ounces of 80 proof spirits, or 1 ounce of 100 proof spirits. Red wine has been linked to heart health, but you should still limit the amount you drink. So there you have it, 9 foods and drinks raise your blood pressure. Thanks for watching. Hope you have a healthy and happy day.